Good day, everyone. I am Tshepo Chabalala, a SETCAP junior researcher at the Mandela Mining Precinct, and today I will be doing a presentation on one of my research studies that I conducted in 2020. The title of the research is Healthcare Support for Employees and Local Communities by Mining Companies During Covid-19 Pandemic, with potential for alignment to local government IDPs. In the interest of time, I will be providing high-level information and summary of the overall study. What this study seeks to understand is how the mining industry is supporting employees and communities to deal with the COVID-19 pandemic. The study focuses on how municipal IDPs and mining SLPs relate to each other, with potential for integration and synergies, and more so in their efforts in response to healthcare support to communities during the COVID-19 pandemic and beyond. It should also be noted that the study was conducted during the COVID-19 lockdown levels 4 and 5, with its restrictions in place. Due to these restrictions in place, the study only focused on gold mines, platinum group metals, and coal mines. The main aim and objectives of the study was to identify and determine healthcare support offered by mining companies during COVID-19 and to determine whether the mining social and labor plans can potentially align with the municipal integrated development plans and how these plans have allowed for responding to healthcare support for mining host communities. In line with the outlined objectives of the study and in line with the problem statement and rationale, this study asks various research questions for research, which are individually tackled throughout the study, such as what are some of the legislative contexts driving mining companies and municipalities towards supporting of local communities. In addition, how are mining companies responding to COVID-19 pandemic through their employee and community healthcare support programs and initiatives? What should be noted is that during the lockdown period, the need for energy and petroleum remained critical. Energy and petroleum product supplies plays a crucial role, especially the supply of coal to Eskom for the continuous generation of electricity. Coal mines were allowed to operate with conditions imposed to provide the country with energy. Various mines were placed under care and maintenance. This was very crucial and critical because it meant that some workers had to return to work. This further shaped how this research unfolded and the type of research methods that should be adopted for the study in collecting data. Due to the lockdown regulations in place, the nature and design of the methodology to collect data was streamlined in order to adhere to COVID-19 regulations and to make sure that relevant data is collected. The study is qualitative in nature, with data collected confined to desktop research. I had to rely mostly on publicly available documents for review and analysis focused around COVID-19, SLPs, and IDPs. I had also to be very cautious about the spread of fake news. The literature review focused on support that was offered by mining companies and the government to mining host communities and mining employees. The following are some of the issues that are currently being debated about SLPs and IDPs. Amongst others, they include the alignment of the SLPs and IDPs, beneficiation needs and processes, mismanagement of funds, and corruption by municipal officials. What is more interesting is that the literature reveals that if SLPs and IDPs are aligned, this could enable the government and mining companies to correctly fight against the spread of COVID-19 in communities, and which calls for potential synergies and alignment between SLPs and IDPs. This is significant because mining companies and municipalities will collaborate and establish positive relationships and partnerships. The literature also outlines community social responsibilities and corporate social investments that are advanced by mining companies. Key legislative measures such as Municipal Systems Act, the Minerals and Petroleum Resource Development Act, and COVID-19 Disaster Management Act are very crucial to arrest the spread of COVID-19. Therefore, a crisis such as COVID-19 challenges mining companies in their SLPs and municipalities in their IDPs to be able to drive a common purpose to local communities, to mining employees in the case of this report from a health perspective. The COVID-19 healthcare support is evident as it is outlined in the case study of the research. Mining companies may have went beyond SLP compliance by providing communities with, amongst others, food parcels, PPEs, masks, hospital beds, screening facilities, testing of employees who are returning to work, and conducted awareness campaigns. From the municipal side, municipalities have dispatched personnel from the Department of Health to screen and test residents. Mobile testing stations have also been opened. Here are some of the pictures. The research analysis and findings from the case study and literature review shows that screening and testing for employees and with mining host communities has placed a great strain on the health workforce of mines and municipalities. This means that better health staff workforce planning is needed. Furthermore, alignment between the SLP and IDP provides a platform for investment, economic growth, poverty reduction, and infrastructure development, with potential for synergies between municipalities and mining companies, which will result in the pressure on the health workforce and current infrastructure to be lessened. There is a need to build long-lasting relations and employee capabilities, which means SLPs and needs to be reviewed. Furthermore, clear rules should be spelled out from the MPRDA on SLPs. In addition, measures that are more stringent should be introduced to deal with mismanagement of funds, and officials who are implicated in corrupt activities must face consequences. Communities may also need capacity building in terms of basics for budgeting and communication skills. Mines may need to realign their SLPs to support development, as these are priority areas for effective partnerships and improved service delivery in mining host communities. The following are some of the recommendations for improvement in the alignment of SLPs with IDPs and potential for synergies. They are derived from the findings of this research, analysis, and literature review. To highlight some, the South African mining industry may need to adopt a more localized response to healthcare issues. The minerals sector should fast-track the adoption of technology through the fourth industrial revolution and modernization. Improve the stakeholder engagement between the mining industry and local communities is needed. The sustainability of healthcare support, even beyond the COVID-19 pandemic, may require integrated support initiatives that are economically sound and environmentally healthy, and governed responsible with the involvement and inclusion of communities. A partnership between local government, mining companies, and local communities may need to be ensured for sustainability of communities in areas where mining is operating, including after mine closure in the future. In conclusion, the study has evidenced that the COVID-19 pandemic outbreak in mines have offered healthcare support to employees, and mining host communities may have went beyond SLP compliance in some instances to support communities. I thank you.